No te dice. Hi, my name is Maricela, and I'm a Nursing Gill Nightingale student. I'm here doing my comprehensive assessment, head-to-toe assessment. I have here my boyfriend. His first name and last name is Arturo Perez, and he's going to tell you his name and date of birth. He doesn't speak English, so I'm going to be translating Spanish and English. Dile tu nombre y fecha de nacimiento.
Mi nombre es Arturo Pérez, soy del 8 de mayo de 1981.
He says his name is Arturo Perez and his date of birth is May 8th of 1981. So I'm going to be coming in. I'm going to be looking at the doctor's orders. Looks like he's here for a head-to-toe assessment before going into a procedure. We're going to make sure that everything's okay with him. I'm going to ask the patient if the patient has any allergies. And before I do that, I'm going to sanitize my hands before I come in. I'm going to provide privacy. And I'm going to ask the patient, do you have any allergies? ¿Tienes alguna alergia de
Ninguno.
ningún medicamento? Okay, so he states he doesn't have any allergies. We've already says vitals look like his blood pressure is within normal limits, heart rate's within normal limits, and his oxygen rate is within normal limits, as well as his respirations. He says he doesn't have any other past medical histories other than a history of hypertension. So the first thing I'm going to do is I'm going to, upon assessing the patient, I'm going to assess his appearance, his skin, his speech, how he talks to me, and the way he presents to me. That's the main part of the assessment. And then the second part of the assessment I'm going to do, I'm going to ask him his name, where he is, what time it is, and what year it is. So, ¿qué día es ahora?
Es viernes 10 de abril.
Okay, so he said it's Friday, May 10th. ¿Qué año es?
2026.
And he says 2026. ¿Está de noche o de día?
De tarde.
Okay, so I asked him what time of day. He said the evening. So he's alert and oriented times 4. So I'm going to go ahead and assess his dot at the top of the head. I'm going to explain to him in Spanish what I'm doing. Voy a checar la cabeza y revisar todo el cuerpo para ver cómo está todo, okay? I explained to him I'm going to review his whole body system as an assessment to make sure that everything's okay and to let me know if there's any concerns or pain anywhere. First thing I'm going to do is I'm going to assess the head here for the scalp. I'm going to look for hair, for any lesions, discoloration, changes in skin, or any pain anywhere. ¿Tienes dolor, pain?
No.
No? Okay. All right. And then I'm going to go back scalp. And then I'm going to go down here and I'm going to feel for the temporal pulses. Temporal pulses present. Okay. And then I'm going to inspect for the face symmetry here. I'm going to inspect face symmetry. And we're going to test the cranial nerve 7. I'm going to have him clench his teeth. ¿Te puedes poner los dientes así como la mano? To test the cranial nerve 7 there. And I'm also going to have him squeeze his eyes. Pachorra los ojos. Okay, that's testing cranial nerve also 7. And then I'm going to have him puff his cheeks out. En la boca así. To check for mouth reflex. Okay, everything is great within symmetrical things. I'm going to inspect the ears here. I'm going to look for any bumps, abnormalities in the ear. I'm also going to check this here over here for any bumps or abnormality. Looks like he does have a little bump here. He said he hasn't seen his kid, but nothing concerning. I'm going to check my pen light and I'm going to inspect the inside of the ears here. Look for redness and look for the tympanic position, tympanic membrane color, position, and bulging and integrity. Okay. And then I'm going to do the opposite, same for the opposite side as well. Checking for the same thing. Okay, no abnormalities, clear, no serum, intact, everything's intact there. Okay, and then I'm going to test the whisper test on him. I'm going to let him know what I'm doing. Te voy a hacer una prueba de que me escuchas cuando estoy hablando bajo.
Okay.
Can you hear me? ¿Puedes oír?
Okay.
Okay.
Yeah.
I'm going to check hearing this side. Can you hear me?
Okay.
Okay, you can hear me? Okay. So hearing is intact. Then I'm going to go down and I'm going to assess his nose, the symmetry of his nose. Got midline, no deviation to the nose. I'm going to go ahead and palpate the sinuses here for any puffiness or swelling, any abnormalities. I'm going to go ahead and test the his nasal area. I'm going to test the reaction to him breathing, swifting in and out. Can respira profundo por fuera, on both sides. Passage here. Okay. Alrighty. And then I'm going to test for the oculation of each nose. I'm going to check inside the nose with my pen light. I'm gonna check the inside. Okay, that's pink and warm, clear. No mucus or anything in the nose, no. The nose, okay, that's clear. Alrighty. And then I'm going to have him close his eyes to test for cranial nerve 1. Puede cerrar los ojos? Okay. And then I'm going to have do a sense of smell. Te voy a dar como un senso olor que dirá que sea, me dices de qué olor hueles. Dime cualquier olor. Tell me what sense smell.
Presa.
Okay, so it says he smells strawberry. Okay, and then I've already checked the internal nose, so the septum here area here. And then I'm going to check for the palpate for the tracheal line here. His trachea looks like it's midline. I'm going to palpate for any lymph nodes here, any irregular lymph nodes or bumps, any just jugular vein distensions. No, looks like everything is normal. I'm going to check the carotid pulse here and Brute with my stethoscope. Okay, present, pulse present. Check both sides here with the bell of my stethoscope. Okay, all right. And then I'm going to go down, since I'm already right here, I'm going to go ahead and test the range of motion with the shoulders. Si puede levantar los hombros to check the reflex in shoulders y para abajo. Okay, I'll voltear la cabeza. I'm going to have him turn the head to the right and the left. Rotate his head. And then have him rotate his head up and down. Okay, all right. And then I'm going to go ahead and take my pen light. I'm going to check his vision here with his eyes. And I'm going to explain to him what I'm doing in Spanish, then I'll translate it in English. I'm going to take my pen light and I'm going to have him look at I'm going to have him look straight. And I'm going to focus the pen light into his eyes to check for the perla. Okay, so deja los ojos derechos y no me sigue derecho. Voy a checar la luz aquí. Okay. Bilateral, equal to light, reactive to light. Okay. All right, and then I'm going to check also the visual balance of his eyes. I'm going to have him follow my pen from up, down, side to side, and into, like, going in towards him, okay? So vas a revisar la pluma aquí de luz, vas a seguir la pluma con la luz. To the right, to my left, up, and down, okay? At that time, I can also set his eyes and his sclera and a conjunctiva to make sure there's no redness or yellowness or any other come in his eyes, and everything looks within normal limits there. Okay, and then I am going to go back to the ears and check here, and I'm going to gently tug on the auricle here. For males, I'm going to tug back, up and back. For kids, I'm going to tug down and back when checking the auricle, okay, for position and alignment for the ears. All right, and then as I'm going to go ahead and check the mouth. Puedes abrir la boca? I'm going to shine the pen light. I'm looking back at the tonsils. Tonsils are red a little bit, warm, moist in there. Tongue looks okay. Teeth looks okay. The gums look okay. Mucosa muca looks okay. I'm going to have him stick his tongue out. ¿Puedes sacar la lengua, por favor? All right. Have him stick his tongue out. I'm going to look for the oval of tongue. I'm going to have him to his tongue side to side. A la derecha, a la izquierda, para arriba, para abajo, up and down the tongue. That's testing for the oval of tongue mobility. Okay. All right, and then I've already checked for the neck, the symmetry, lumps, and pulsations here. I'm going to palpate the cervical lymph nodes. I checked the carotid arteries. I'm going to check for the rate, rhythm, and strength here. Let's say the rate is about 74 beats per minute. The rhythm is bounding pulse, and the strong pulse. Okay, all right. And then I'll palpate the thyroid. Palpate the trachea, the midline here, it's midline. All right, and then I'm going to palpate the Brute with my bell and my stethoscope. Listen for the Brute, or listen to the carotid. All right, now I'm going to listen for the Brute. Okay, that's present plus. Present plus, okay. All right, and then I'm going to test go down to the lower extremities now. So I'm going to have him check his radial pulses here. Okay, 2+ radial pulses. I'm going to check his brachial pulses. 2+ radial pulses. I'm going to come down and check the capillary refills here to make sure. Voy a chequear la circulación de las manos aquí. Estaba checando el pulso, just translating in Spanish. All extremities to make sure they are all within under 2 to 3. To return at the swift returns promptly. Okay. Looking for any deformities. All right. And then I'm going to check the chest here and the area here for any deformities. I'm going to note that if the chest is symmetrical, if it's round barrel chest, if you had a round barrel chest, maybe be a significance of COPD or any other respiratory problems that you have. He's using his regular breathing muscles, nothing abnormal there. I'm checking for excursion and depth and rhythm as well. I'm going to go ahead and observe the breathing, and I'm going to auscultate the lungs now. Voy a chequear los pulmones, ¿ok? Tú nomás respira profundo. Breathe in and out, 1. Checking for raising bronchi or any crackles. Okay. Ausculted all areas of lungs. Clear with no signs of wheezing, crackles, or bronchi noted. Okay, then I'm going to auscultate the heart sounds by using the 8 to man pattern. And the 8 to man pattern is the aortic, pulmonic, Erb's point, tricuspid, and the mitral valve. S1 and S2 present, no presence of any murmurs, clicks, or rubs. Okay, so everything is clear there. Then I'm going to ask the patient to go ahead and lie back so I can assess his abdomen area. Así, por favor, te podrías acostar para checar abdominal. No, ya está bien, está bien. Okay, all right. And then I'm going to ask him to lift his shirt up. Está bien que levante la camisa un poquito. So I'm going to lift the shirt up, just shows abdomen area, okay? All right. I'm going to inspect the area for any abnormalities, inspect the skin, see if there's any redness. And then after I do that, I am going to auscultate all 4 quadrants of bowel sounds. And I'm also going to ask the patient if he's having any trouble using the restroom. ¿No tienes problemas haciendo el baño?
No.
Okay. Orinando, haciendo del baño, no tampoco? No estás estreñido? No. Ask the patient any trouble urinating or bowel movements, or if he's constipated. He's saying no troubles at all. I'm going to auscultate all 4 bowel sounds. Okay, present. Hypoactive bowels. Hypoactive bowels. Okay, hypoactive bowels present in all 4 quadrants of the stomach. Next, I'm going to percuss all 4 areas of abdomen to assess the area around the umbilical area. And I'm going to percuss. And then after that, I will palpate lightly and palpate deeply. Voy a chequear poquito presión en la panza, primero los 4 lugares. Y luego chequear poquito más presión. Me dice si tiene algún dolor.
Okay.
I'm letting the patient know I'm going to palpate his abdomen area. First light in 4 quadrants, and then a little more deeper in 4 quadrants. Okay, now I'm going to palpate deeper. Any pain, dolor?
No.
No? Okay, great. No abnormalities with the abdomen. Everything looks clear. Bowels are hypoactive in all 4 quadrants. No problems going to the bathroom. No distension. No tenderness or dullness in the abdomen area with sounds. Okay, I'm going to go ahead and have the patient sit up now so I can finish my assessment. Si te puedes sentar para ir, por favor. Okay. As the patient's sitting here, I'm going to go ahead and listen to, I'm going to go check his legs here. So, te voy a levantar el pantalón, okay? So I can take a look at his legs and also listen to all of his pulses. Fetal pulse, popliteal pulse, and dorsalis pulse, okay? All right. I'm going to inspect his legs here and his feet for any redness, swelling, look for any edema. No edema noted. Okay, I'm going to check for the pulses. Fetal pulses, dorsal pulses, 2+. Popliteal pulses, 2+. Okay. Everything looks good there. Okay, I'm gonna go ahead and have the patient pull his pants back down. Vamos a bajar el pantalón aquí, por favor. Put his pants back down. And I'm gonna have the patient stand up to test for strength gains and mobility. Se puede parar, por favor? Okay, I'm gonna have the patient with this was lado turn that way, and I'm gonna have him walk straight so I can and bend over, to check his spine for any abnormalities or check for kyphosis, scoliosis. Okay, para arriba, step back up. I'm gonna have him walk straight forward, camina adelante, and I'm gonna have him walk back towards me again, para el otro lado. Okay, and then I'm gonna have him turn back. What is the lado? I'm gonna have him rotate his arm to check for mobility and the elbows. I'm gonna have him lift his legs up and down in the lower extremity mobility. ¿Puedo levantar las patas así 2 veces? Okay. ¿Y te puedes agachar a tocar los pies? All right, flexibility and mobility. Good. ¿Algún dolor? Pain?
Ninguno.
No? Okay. Con así. ¿Se toman asiento? Okay. And then I believe this concludes my head to toe assessment. Patient shows no abnormalities. Vitals are stable. I'm going to go ahead and document everything the doctor is saying that everything is within normal limits for the head to toe assessment prior to his procedure he's going to be having. Then I'm going to ask the patient if he has any questions or concerns for me. ¿Tienes alguna pregunta
Ninguna.
o preocupación?
Ninguna.
Okay, no questions or concerns. So I'm going to go and I'm going to wash my hands, sanitize. I'm going to thank the patient, document, and then leave the room and let the doctor know of the findings. Gracias por dejarme ayudar a cuidarte a ti. Voy a revisar con el doctor lo que revisamos y ahorita estamos contigo.
Okay.
Okay? So I thanked the patient, told him thank you for letting me treat him. I'm going to let the doctor know what's going on. I'm going to document, wash my hands, and that will be right with him. I'm going to go and open the privacy door. I'm going to leave and exclude myself. And that's the end of my assessment. Thank you.